Doctor, these people have been impacted by the external environment, especially at the mental level. I think you can give us a perspective of how the ordinary Nigerian has fared in the past 2 years of reforms.
World Health Organization has said health is wealth. I don't think if anybody has an excruciating headache right now would be in this room. No, you will not at all, because your focus will be on that headache. How will this headache go? What do I need to do? How do I make progress? You know, I have 10 things to do this day today and I can't even do any one, because the headache might even start affecting your eyes, or you may even start feeling feverish. You may even already start thinking it is malaria. So yes, in my Nigerian mind, I'm going to say we are not doing well health-wise. But of course, I speak a lot of times based on scientific, basis, and also doing deep research into not just taking one side and leaving the other side. I've had to be in the Ministry of Health, spoken with a lot of people, colleagues that are also in different parastatals, the MDAs, and what is really going on. And this is where I want to also quickly chip on board. The government is not doing enough to give us information on things, reforms they are doing behind the scenes. If we are doing reforms and we are not seeing it, we are not feeling it, we are not experiencing it, it's as good as you are not doing anything. That's just it. It's pure. No, it's basic. When you look at the word 1,000, the letter one, is it letter now or 1,000 as 1000? That's numbers, right? And 1 is representing health, 0 representing family, the second 0 representing money, the last 0 representing career. Without 1, all the rest are 0. So health is that powerful. So this current administration, in the last 2 years, what have they done? The truth is that I would say we are standing on a very qualified somewhat. Not yes, not no, somewhat. That means it is neither here nor there. Because some people, health is not really, they are seeing some improvement, and I will give parameters to showcase the reforms that are ongoing that will show us that if these reforms are not being done, we are definitely not going to see the change we want to see in the future. The Minister for Health, Professor Epate, spoke recently and said, yes, people are not yet seeing those reforms or experiencing those reforms, but we need to do what we need to do. But in the next 5 to 6 years, we start seeing the benefits of these reforms. And one thing I have to bring into fore is the National Health Insurance Scheme that has been, turned into an act now, that is the National Health Insurance Agency Act. So what has that done for us? Before now, we have less than 10% of Nigerians covered by health insurance, which is significantly very, very poor. Very, very poor. But between 2023 and 2024, we have had some coverage from 16.8 million to like 19.1 million now, which is just about just 10%. Are we happy with that? No. That means that Nigerians are still doing over 70%, we are still doing out-of-pocket payment. Now, health management organizations, sometimes you go there, they will tell you your package is not covering XYZ. Some they won't tell you that this sickness you have is self-induced. Like for fertility, they will even cover it. They will tell you that it's your issue. If people, I'm a mental health physician, as a psychiatrist, when people come in for drug rehabilitation, it doesn't even cover. There are some mental illnesses that you need minimum of 2 weeks to 1 month to be in the hospital. The health insurance scheme will tell you it's just 5 days. So that means at the end of the day, you are still going to do out-of-pocket payment. So we have seen reform with the health insurance scheme, now to the act, which is soon covering just barely just 10%. And of course, the mental health act, which was a good gift, that parting gift that the President Buhari gave us before leaving, which I was very ecstatic about. By the way, Nigerians are very good with laws. We have very fantastic laws, but our problems have always been implementation and execution. So yes, we have that health insurance act that is been there. Then of course the coverage has just moved barely to just 10%, which is still very, very low. There are some HMOs that you don't even want to join. I won't mention name here because for me, I don't even deal with Over 90% of Nigerian HMOs, I don't deal with them. They don't pay well, they don't pay on time. They will stress you out. They are telling that this hospital did not do this, X, Y, Z. Who is going to pay the salaries at the end of the day? You know, they are not, it's not balanced. You know, when they say the balance is not balancing, this is where it is. So yes, the health insurance, the Health Act is there. The coverage has just barely moved a little bit. We have 10% coverage. Can it be moved to at least 30 to 50% in the next 2 years? All these are drivers to universal health coverage, whereby if I leave and I go to Port Harcourt today, I can, with my card, with universal health coverage, I can access easily, and it is affordable, accessible, available, and of course acceptable by us. That's what universal health coverage literally means. So let's see, in the next 2 years, can we move from this 10%? It's good. Is it possible to move to 30 to, I may not say 50%, because I know they say government is a continuum, and it may be too bogus for me to, say, but at least let's just move, shift a little bit, a quarter, 25 to 30%, strengthening of our primary health care. If our primary health care centers are functioning well, not the ones that goats and sheep are sleeping and dogs, no. You will not go to Bagata General Hospital, or you will not go to Lut, which is the tertiary. But any little thing, small fever, we are running to Lut, or we are running to the secondary institution. No, the primary health care center, we all have them in our locality. If you don't know where your primary health care center is, go look for it. There's one. Either it is locked, or it is being abandoned, or we have animals living there, so people, homeless people have taken over. So, but in this administration, we are gradually seeing improved, strengthening of the primary health care centers, which of course it's a good thing. But in all of this, the challenges still loom. There's still a lot of challenges, and I'll go to one biggest challenge: maternal mortality. We have the highest in the world. Highest maternal mortality. That means that that one that is pregnant that goes to the hospital, it's neither here nor there. How can we be the highest in the world? We surpass India, we surpass many other countries. About 75% death. So we still have that. So maternal and child mortality, by the way. Another thing is the fact that you can't stop people from moving. The jackpot syndrome has taken over. Yes, brain drain. We are hoping for brain gain. For some of us, like me, myself, and my team in mental health, we are not even worried about that anymore. We now have a telemedicine platform that is delivering culturally appropriate therapy to people of color, blacks, Nigerians, and of course Africa in general. Why? Because when you go there, you can't stop them. But when you are there, please, can you log in online and deliver culturally appropriate therapy to somebody that needs therapy anywhere they are in the world, whether they are in their bedroom, in their workplace, and all that. So we have seen that workforce crisis is really a big issue. And of course, the poverty. We have weaponized poverty so much that you people are deciding whether to eat or take medication, and it shouldn't be. We basically see people walk into the hospital. You've given them medication, take this, 2 in the morning, 2 in the night, and they are coming to tell you after 1 week, maybe they are follow up, and they are telling you that I still have a medication. You know that those medications should have finished yesterday. Say no, Dr. May, I took one today. I'm reshuffling it myself. Like, are you a doctor? How will you be reshuffling your medication? There is potency to it. There's half-life. There's a use for this medication. So the person is hypertensive, is supposed to take one medication or two, one morning, one night, and is taking one every other day. And you are wondering why there's this slum and die syndrome?
What would you like to see in the next 2 years in your area?
Yes, in health.
From federal and state government.
Let's strengthen our primary healthcare system. Strengthening means infrastructurally, standardize them. Strengthening means we have to train the trainers. Train the trainers just means that we have a World Health Organization document, we call it for mental health MHGAP. And then of course we have document from WHO. You can train in settings where that they are not as big as general hospital or tertiary or secondary or tertiary institution, where you can train them, they can pick the early signs and symptoms and refer appropriately. So, boost, increase training and the training and all that. And of course, ensuring that essential drugs are available. Essential drugs are just the regular paracetamol, some basic antibiotics, painkillers. They don't have to be those as expensive as augmentin, right? Those essential drugs should be available in those. And of course, we also now talk about NHIA. Now it's an act. So health insurance coverage, strengthening of our primary healthcare system, the tariff that is removed from pharmaceuticals, let's remove the other bottlenecks like electricity and of course what they call it, cost of production and getting things to procurement and supply chain being done. Then most importantly, when it comes to mental health, we have a mental health act now. Like I said earlier, beautiful. But one of the core part of that mental health act was that they should have a national council for mental health, whereby the CEO will be overlooking the service delivery and all that. Let us have that national council where we have that national council has a chairman, has CEO, then has a committee of different aspects of the ecosystem, including an individual with lived experience. We need to pump money into the healthcare sector. Yes, it's in as much as agriculture is important, education is important, health is wealth. If health is not there, nobody will go to farm, nobody will go to school, and nobody knows the kind of sickness that is going to kill them. The real test we are seeing here is that when the average Nigerian, a farmer, a single mother, an unemployed youth can walk into a health facility and receive timely, dignified and affordable care, that is where we know that we are turned in the right direction.